With vaccines the big focus right now, there's been less talk of rapid testing, but experts say the devices are key in the fight to containing outbreaks. The federal government says it has procured tens of millions of rapid tests, but only a small portion of them are in use. And as Abigail Bimman reports, access depends on where you live.
You got your health card.
Pop-up sites in Nova Scotia.
I thought I would come in and make sure I'm still good.
2 high schools in Montreal, Vancouver's downtown east side, and long-term care homes in places across the country. They all have rapid test pilot programs, but only pilots, months after the first tests were approved. The National Testing and Screening Advisory Panel calls antigen test deployment a priority in a new report.
We need the federal government to procure more of them, we need the federal government to approve more of them, and then we need the provincial governments to support the more rapid use and wide-scale use of them.
Let me just say that we have procured over 40.5 million rapid tests.
But only 15.4 million have actually arrived, the rest to get here by the end of March.
I don't know where this is going, but rapid testing to me would be an absolute game changer.
As managers and administrators turn their attention to the vaccine rollout, what we've seen in a number of provinces is that testing volumes are going down.
Dr. Irfan Dalla says no one knows for sure why rapid testing hasn't been happening more rapidly, but he points to an overstretched healthcare system with attention on the vaccine and a tendency to prefer a higher quality test, the gold standard PCR lab test.
The antigen test, for all the benefits that it can be quicker and easier and cheaper, the downside is that you do get more false negatives.
And some of the rapid antigen tests do have up to a 30% false negative.
Because of that, antigen tests are recommended for screening purposes in targeted populations, and many provinces require any positive results to be confirmed by a lab.
Everybody wants more. And we are just trying to keep up with demand.
The other type of rapid test uses nucleic acid, closer to PCR in terms of results, but more expensive and complicated than antigen tests. Cepheid's Fluvid test is one of the latest nucleic acid rapid tests approved by Health Canada. It tests for flu as well as COVID.
We're really focusing on sick patients coming into the hospital, where it really matters to have a very sensitive and specific technologies.
Dr. Dave Persing doesn't think Canada is behind in terms of procurement, but he won't give specifics.
So where's Canada on that list in terms of how much we've purchased from you compared to other places?
I don't want to get into that because it'll be a little controversial.
Canada's top doctor says she is hearing about more jurisdictions implementing rapid testing. Teresa Tam says as case numbers fall, it's important rapid testing capacity is in place before restrictions ease. Abigail Bimman, Global News, Ottawa.